I'm Dr. Olivia James from Brindabella Equine Mobile Veterinary Service. I'm here today to tell you the top tips about equine first aid. The first thing you need to do is just to stop and assess the situation. Is it safe to approach your horse? Is your horse anxious? Is it going to become more anxious if you approach it? Looking for any fallen fences, any wounds. What can you see in the first instance? The second thing to do is, if there's any bleeding, is to stop the bleeding, especially if it's gushing. A clean towel will do the trick, or in a real pinch, even a t-shirt. The third thing to do, if it's safe, is to clean the wound. A trickling hose will often do the trick. Cold water can reduce inflammation, and once you clean the blood away, it makes the wound easier to assess. The fourth thing is to decide if the wound needs any further treatment. Shallow grazes can often be treated at home. If you're unsure, it is best to consult your vet. Top tip number 5 is to dress the wound. If the wound is on a leg, it's a great idea to bandage the wound to keep it clean, stop the bleeding and prevent any further contamination. The best layer to use on the bottom closest to the wound is a non-adherent dressing like Melanin, followed then by something soft to use for padding such as a combine bandage. The middle layer is then a crepe or an elastic bandage, and then the final layer is something like Elastoplast, which will keep the bandage upright and stop it from slipping down, as well as applying pressure. The sixth top tip is to reassess the wound. This can be done in an hour, in a day or in a week. You need to decide if it needs any further treatment. All horse owners, like Boy Scouts, need to be prepared. This means having a fully stocked first aid kit wherever your horse is. This may be close to your paddock or your stable, or if you're travelling your horse in your car or in your float. It's a great idea to know what is normal for your horse, so having a stethoscope and a thermometer as part of your first aid kit is a really great idea. The other thing that can be really useful is to have your vet's phone number pre-programmed into your mobile phone. You can always, with the smartphones these days, you can take pictures of the wounds and send them to your vet. The 5 most common vital signs taken in a horse are heart rate, temperature, gums, respiratory rate and their skin turgor. The heart rate of a horse at rest should be between around 38 to 40 beats per minute, but again it's important to know what's normal for your horse. The rectal temperature of a horse is between 37.5 and 38.5, so it's a lot higher than it is in humans. Their respiratory rate is generally around 12 to 15 breaths per minute. Horses that are in pain or distressed often have a much higher respiratory rate. Their gums should be pink and moist, and when you pick up a pinch of skin on their neck, it should disappear completely within 1 to 2 seconds. Any longer than that means your horse is dehydrated. I hope you've enjoyed our top tips for equine first aid. For more information or to find a horse vet in emergency, go to Equine Dental Vets.